You say Mental Health America's mantra is we have to act before stage 4. What does that mean?
Well, mental illnesses are the only chronic conditions in America that, as a matter of public policy, by applying a danger to self or other standard as a trigger to treatment, that we have waited until stage 4 to treat. That's not how we treat cancer. It's not how we treat heart disease. It's not how we treat any other chronic condition. The way we should treat is to act before stage 4. We should do it through early identification and through early intervention. And we have a tremendous opportunity, sadly, in front of us this year to be able to do that for the population as a whole.
You say healthcare workers are especially vulnerable. Tell us about the unique challenges they're facing.
Well, healthcare workers not only have to worry about their own health and safety and well-being, they're also worrying about the people that they are exposing, their family members, their loved ones, and other people in the community. And they have to be concerned about the fact that, sadly, they're losing so many people who were healthy a week or two earlier who are now not healthy. So they're living with that. And so for them, the challenges are special. They face all the challenges the rest of us do. But as frontline workers, they and other service industry people and other first responders are especially affected by this.
People who don't understand what it's like hear about anxiety or depression and they say, you know, have a glass of water, cheer up. But give us the facts, right? It is estimated that if unemployment reaches the 1930s Great Depression levels, that would be 25%, we could see suicides in this country increase by 18,000. Overdose deaths go up by more than 22,000.
Yeah, if you look right now, we average 45 to 50,000 deaths by suicide on any given year. And that's a number that sadly hasn't been going down over the course of the last couple decades, largely because we wait too long to address suicide. We wait until people are thinking about suicide. Well, in April alone, in our screening program at Mental Health America, 7,000 people told us they were thinking about suicide on more than half the days. And the problem is we haven't even seen the effect of the bad economy yet. The reasons they're citing are loneliness and isolation, worry about COVID-19, past trauma that's coming back to haunt them. The grieving and the financial issues are going to be coming along in the summer as the numbers of deaths increase, and through the summer and the fall as people's financial worries intensify. And then we're going to see a wave built on top of a wave of serious mental health impacts. So anybody who thinks that the depression is going to go away, the anxiety is going to go away, it's magical thinking. These things are not going to happen on their own. We have to intervene now, and we've got to intervene aggressively.
So what do we do? What resources are available now for people who are feeling any or all of the above?
Well, 100% of us are feeling worried. And the problem is that for many of us, that worry is transitioning to anxiety, to depression. Even for people, we're seeing it in our screening program, to psychosis for some people. I think that we need to take the guesswork out of what it is that's going on. Take a mental health screen. They're free. They can take them online. They're widely available. You get an immediate result so that you can take the guesswork out of what's going on. And if you are struggling to any extent with the isolation, the loneliness, the worries that you've got, the anxieties, the depression, any of that, we offer, and so do many others, resources free of charge that are available to people while they're in their own homes to be able to use online to help themselves not only feel better themselves, but also have to engage with other people to make sure that they're helping others and others are helping them.
Paul, thank you so much. Thank you for speaking to us. Thank you for all the work that you do. And for you at home, if you or anyone you know would like more information about resources available to address mental health, you can visit Mental Health America's website at mhascreening.org. And it's not just mental health. There is also been a spike in domestic violence recently. I think about it all the time when I think about all those families in crisis who are quarantined. But know that help is available through the National Domestic Violence Hotline at 1-800-799-7233.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.